I'm KDA Executive Director Kevin Robertson, and this is the KDA Video Minute for Friday, January 22nd. Well, the big news in the Kansas legislature this week is our bill, the KDA's bill, to prohibit insurance companies from capping non-covered services was introduced, printed, bill numbers assigned, and we've got it scheduled for a hearing. So, in a nutshell, it is Senate Bill 389. It was introduced by the Senate Financial Institutions and Insurance Committee, and the hearing is on Dental Day, Thursday, February 4th at 9:30 a.m. So that is really great timing. We were able to work with Chairman Ruth Teichman to get that bill scheduled on that day. So hopefully we'll have lots of members in town that'll be able to participate in the process, to have the hearing, to see how this all works, and to talk to legislators about this very important issue for so many of our KDA members. So we will, as a result, have to adjust some of the agenda and the schedule of things that we normally do on Dental Day. That's something we're looking at right now, and here within the next week we'll let everybody know what the agenda looks like and what our change in expectations for the day are. But we're very excited that that all is going to work out, and we look forward to having many of you participate in Dental Day on Thursday, February 4th. Now remember that does include a buffet luncheon for our legislators at the Dillon House, which is a location right across the street from the Capitol, and the more people that can attend, the better that event will be. So please, we look forward to you attending. The Dental Day information is included at a link with this website, as is the information on Senate Bill 389, or the actual bill, so you can look at it and see exactly what that bill does say, so you know what this is all about. So again, thank you very much for all your help and support on that issue, and we'll continue to update you and keep you informed on who to contact on the Senate committee to get this issue rolling. Another significant issue that will or could possibly affect the Kansas Dental Association is really the whole issue of possible increase in taxes. Today on the House side, the House Tax Committee started to have hearings on a 1% tax increase that was proposed by the governor. Now within that discussion, there was some suggestion that the state shouldn't be looking just at a tax increase, but should be looking at eliminating sales tax exemptions and also possibly taxing some services or all services that are provided. So those are both things that could affect KDA. Obviously, healthcare services, along with all services, are exempt, and those things in your dental office, when a patient comes in, of course, you don't charge them tax for that service that they've been provided. And then also, several items that you purchase that are health related are exempt from sales tax. So these are all things that are sort of on the table right now as the state struggles with trying to fill in a $400 million deficit as we look at the FY 2011 budget for the state. So again, it's just a very preliminary discussion on those things, but they will all be brought up and all discussed throughout the course of the year. Another thing, maybe a little more minor or less important to KDA members though, is an ongoing issue that has occurred where the state has swept or basically stolen fee service funds or fee funds from licensing agencies. So for example, in the past, the dental board fees that you all pay to the dental board has just been taken out of that fund by the state in order to help balance the budget. Now last year we were able at the last second, working with a little coalition of some other groups, to get the dental board's money safe, but the governor's budget does include $2.4 million in fee fund sweeps this year again. So the money that you're paying to be a licensed dentist that goes to the Kansas Dental Board is actually being taken, and it really is an added tax that you've been paying the way it's been distributed over the last few years. So we're also looking at that and trying to prohibit that from occurring as well as this debate goes on. So again, like so many issues right now in this legislative session, it's too early to tell how anything's going to work out, but we'll keep you up to date with that. Yesterday afternoon, Andy Allison, who's the head of the Kansas Health Policy Authority, which oversees Medicaid, had a discussion with the Senate Committee on Ways and Means where they talked about some different issues with regard to the 10% Medicaid decrease that the governor imposed effective January 1. He talked about how that was affecting services both to Kansans in general that qualify for Medicaid, as well as how it's affecting providers and the services that are being provided to providers, because there's no longer any type of provider support. You can't call in and get information from the Medicaid people as to claims, whether or not they've qualified and things like that. So it's causing more claims to suspend. It's causing just really a backlog already in the system, even though we're only 2-3 weeks into that change. So that was discussed a little bit, and then as we go and look at the future of what the budget is in the state of Kansas, right now the budget calls for no increase in the provider rates, or when I say no increase, I mean maintaining that cut level through fiscal year 2011. So the Kansas Dental Association is involved in a Medicaid provider group that's looking at ways that we can encourage and kind of change the message to legislators, so that we're in there right with the schools and the highway programs and everyone else who wants an increase in funding or doesn't want to cut, how we're going to do that in order to encourage legislators to see that that's a very important issue. The thing that legislators need to understand is, of course, Medicaid is a state federal match situation. So if you cut, for example, in our case, $27 million from the state Medicaid budget, it really affects over $140 million in total social services dollars with the match that comes in from federal government. So the money that Kansas is saving by reducing provider rates really has a 3 times effect when you look at the money that we're not receiving from our federal match. So those are all things that need to play into this discussion and ways that we're trying to couch the conversation with legislators as we try to convince them that decreasing Medicaid rates is not the way to proceed to cut taxes or to cut expenses with the state budget. Finally, you remember last week we talked a little bit about what we call the Video Minute. We did have a survey online and still have that survey online. Many of you have gone and taken the survey. We did get one suggestion for a different name. That was KDA Up to the Minute, to obviously express that it's to the minute, people are up to date. So we kind of were excited about that change, and based on the results that we've gotten so far, we're going to keep the survey online. We're going to replace KDA Video Log, which wasn't receiving many votes, with KDA Up to the Minute, and we are going to encourage you to continue to vote and take the survey as to the name of the KDA Video Minute to see if there's something else we might want to do. I believe right now we have KDA Video Minute, KDA 360, KDA Full Circle, and KDA Up to the Minute as your choices to vote. So if you feel strongly about any one of those names, or we'd encourage you to provide your input as we tend to look at it, make that decision here in the next coming weeks. Change the name and a little bit of the graphics perhaps with the Video Minute. So again, thank you, have a great weekend, and we will see you next week with the next edition of the KDA Video Minute. Thanks.